nipa ba ha pa wo hwe baabi esie no a Kumasi se wo kotafo a wo bre manhia wo bre Kumasi South wo bre ha de amanfo mbre enti omota ba ha pa.
The request for the construction of the facility was occasioned by an earlier donation the club extended to the hospital during the peak of COVID-19 pandemic. According to the chairman of Unique Royal Club, Anthony Kofi Jamfi, the Suntreso Government Hospital expressed concern about the lack of an isolation center for infectious diseases.
Whilst this constitutes our single biggest support to the health sector in the region, built at the cost of 295,000 Ghana cedis. The club has for the past 10 years provided support in various forms, mostly critical life-saving equipment, to numerous health facilities in this region. The request for this facility was occasioned by a donation we extended to the health facilities during the peak of COVID-19 pandemic last year, including the Suntreso Hospital. The hospital expressed great concern during our donation about the lack of an isolation center for not only the management of COVID-19 cases, but also infectious diseases. It was in response to this critical need that the club undertook this landmark project to resolve this gap and save life.
Mr. Jamfi says the club will continue to build social partnership for sustainable health delivery system to inspire others to do same.
The theme for this commissioning, building social partnership for sustainable health delivery, has been chosen to inspire their social clubs in the region and Ghana at large to forge partnership with the health facilities in the country to bridge critical infrastructure and equipment gap in our health facilities. It is our expectation that the facility will be put to good use and well maintained, not only as a living testimony to our collective sacrifices, but to inspire other social clubs to emulate and enduring this gesture. So, Doctor, I hope you are going to put a good use to this hospital for us.
Medical Superintendent of the Suntreso Government Hospital, Dr. Thomas Ajako Poku, was excited at the intervention. Dr. Poku says the facility will help reduce the usual pressure and provide a better place for patients with infectious diseases.
The affected patient away from the main wards. And hospitals with isolation find it difficult. Sometimes one patient can occupy the whole ward to such an extent that we can't put any patient there. And we saw this during the COVID period. So, isolation ward has everything in it to ensure that the staff and visitors and people around are not affected. Usually, such patients are removed from the general society. So, it's important that we have this. We are lucky to have this capacity to be able to cater for patients. In the past, we used to refer our patients to Kompanochi. And today that we have this building, it will help us improve management of infectious disease in this hospital.
Because we need partnership to address the COVID-19 issue. And more importantly, partnership that is coming from the private sector. You realize that at the beginning of the pandemic, we had a number of challenges. And one of our major challenges was how to get isolation centers in the COVID treatment center. So we had to go around trying to look for facility, and at a point in time we had to use even hotels for isolation. That is not the best. So I'm happy, very, very happy that at least we have a private sector, a group of people from the private sector coming together to put up this beautiful facility.
So this one has come as a great reliever to us. At least if we had this, we could have put some of the patients there. And I'm praying that other people can also emulate what they've done and also provide some facilities for various health centers within the Ashanti region.
Mr. Jamfi commends members, patrons and associates of the club whose immense contributions and sacrifices made the Royal Isolation Center possible. A report by Mohammed Nuruddin.
Bia no e wo ni e ja chairman aka se ne bia